This is a conversation with Dr. Robert Hedaya. Hi, Dr. Hedaya.
Hi, how are you?
Good, thank you. So you call your work Whole Psychiatry, which is a very evocative phrase. Do you want to maybe talk a little bit about that?
Well, first let me tell you how the idea came about. I would say that, first of all, I've always been an integrative thinker. It's just my nature. And I noticed as I was in practice for a number of years that medication and therapy were not the be-all and end-all. In 1986, after being in practice for 3 years, I had a patient who was about 50 years old and had the onset of panic attacks for the first time in her life. She had no previous psychiatric history. And so I thought this was pretty easy to deal with. I thought it might be related to the fact that she had a bad marriage and her only child was going off to school. And so she was a little panicked, perhaps, about maybe leaving her marriage or missing her child. So we started with some cognitive behavioral therapy, and that really didn't help very much. So I decided to use medication. We went through 3 medication trials without benefit, and this whole process took about a year. After a year, she paged me on a Saturday evening, and she was having a panic attack, and knowing that panic attacks are really pretty easy to treat, I started to wonder about what I was missing. So I went into the office very early on Monday morning and looked at some of the blood work that I had done, which really wasn't much, and saw that the size of her red blood cells was larger than normal. I had ignored it a year earlier because I was taught that if something's just a little bit out of the normal range, it's not worth paying attention to. So I looked a little further, did a little research, and did some testing and found that she had a B12 deficiency. Gave her a B12 injection, and with the first injection, the panic disappeared. So at that point, I realized that the head is connected to the body by this thing called the neck.
Yes.
And it was, maybe there's a lot more going on here, because I think we're all aware of this kind of a revolving door phenomenon in the mental health field, where people see one practitioner and then after a while leave that practitioner and maybe sometime later go back to another practitioner, and they seem to be in the mental health system for a long time. And in the recent years, obviously, there's a heavy emphasis on medication as a major way of dealing with mental health problems, and psychotherapy has taken a second place. But what I realized at that point was that there was a whole other domain, which was the physiology, and this particular case was the first illustration in my practice of that. It led to me looking for other treatable causes of mental health problems, things that might be destabilizing, and one thing led to another, and I started to see that there were multiple systems involved. Then in 1996, after my first book came out, I myself became fatigued, and I think you could say I was on the edge of chronic fatigue syndrome. I started investigating that, and that led me to a field called functional medicine. And I studied that for several years, and in the process treated myself and felt better than ever. And eventually came to understand that there are many different systems that affect the mind, and the mind affects these systems, so it's really a bidirectional network. These systems are nutrition, digestion, immune function, infections, detoxification, oxidative stress, hormones, genetics, epigenetics, as well as psychosocial and spiritual factors. So mental health is a complex process and outcome. And when we're looking at someone who has a mental health problem through the lens of whole psychiatry, we like to really look at all the different levels that could be operational. So
yeah. So very interesting in the the examples you mentioned. There is a broadening. So, for instance, in the case of anxiety, you went to what was in the framework you had at the time, the most likely cure, to be most likely to be effective. Then you went on to something else, which was also likely to be effective. And when you didn't find an answer, you looked elsewhere and found that actually something happened in the body, in this case in the blood. And so that's a question of looking at systems.
That's right.
Yeah. And so then when we talk about mind and body being related, it's actually going to be paying attention to the various systems in the biology of the human being that are going to potentially have also an impact on how moods are affected.
Yeah, I think that's right, and I would even say that mind and body, I wouldn't say they're related, I would say they're part of one whole.
Yeah.
They're really inseparable, and it's an artificial distinction. In the case that I was talking about, this 50-year-old woman, the problem actually started not in her blood, but it actually started in her stomach, because she was unable to absorb vitamin B12. So, I can certainly talk more about it, but I think the most important thing is to understand that mental health is not an isolated part of health. The studies clearly show that people with mental health disturbances have certain diseases more commonly, whether it's diabetes, hypertension, heart disease, osteoporosis, obesity. There's a linkage between mental health and physical health and psychosocial, spiritual status.
So, in a way, as a result of seeing people who have previously seen other doctors, other psychiatrists, other therapists, what is it that you would want to draw attention to, among people who listen to this conversation, who are psychotherapists, who may have a general sense of, the relationship between what happens in the body and what happens emotionally, but don't necessarily have that medical knowledge? What is it that maybe we could be paying more attention to?
Okay, that's a great question. I think it's actually much less complex than it seems. So if I had my druthers, I would have every therapist take a gastrointestinal history and a dietary history. So at the first meeting, you would ask a person either to come in with a 3-day food diary or ask them what they ate for breakfast, lunch, dinner the night before.
Mm-hmm.
And you'll get a sense of what their dietary habits are. Now, obviously, you have to have some knowledge yourself about what a healthy diet is, and that information is readily available. Second thing is to just take a history of how the gastrointestinal tract is functioning. So you ask, are you having constipation? Are you having diarrhea? Are you having cramping, belching, bloating, gassiness, reflux? Very simple. Those questions might take 3 minutes. Why is that important? It's important because the gastrointestinal tract is the foundation. It's one of the main foundations of health. I would say the foundations of health are the gastrointestinal tract and nutrition, the air we breathe, the sensory input, including the thoughts and, let me not say thoughts, let me say the input into our minds, We're really talking about input. What are the inputs? So
Mm-hmm.
the inputs in terms of, what do we watch? What do we read? What do we listen to? Who do we hang around? What kind of sensory stimulation? How much touch do we get? How much exercise? And what do we eat? And how do we digest our food? Those and the air we breathe. Those are the main inputs. And so the gastrointestinal tract is a major input. We eat 3-4 times a day. What are you eating and how are you processing it?
Yeah.
That's the fundamental. That's one of the fundamentals.
So incredibly simple when you describe it this way, say that what's happening, say mood disorder or what we observe are symptoms, they're the output, and what you're looking at is paying attention to, on the one hand, the input, and two, the way in which the system processes it.
Yeah, I think that's a good way of looking at it. Sometimes I look at it in other ways, antecedents, triggers, and mediators, but I think what we're talking about is very, very true and real. And then I would say the inputs also wash out over our genes.
Mm-hmm.
And affect gene expression. But I think for a psychotherapist purposes, taking that really good dietary history and nutritional history and gastrointestinal history takes all of 5 minutes. And following up on that, if there are problems with repeating the questions in 2-3 weeks, so that the patient, the client begins to understand that this has some importance, and then you're kind of observing what it, and helping them along. And then if need be, you refer them, whether it's to a nutritionist or a gastroenterologist or a functional medicine doctor. And in that way, you can be tremendously helpful.
Yes. And so, in a very practical way, the helpfulness of this is obvious, but there is another part to it that, in a way, by doing this, in a very concrete way, you have established the relationship between what we do and what we ingest and how we feel. And so
that's right.
That's very clearly communicated to the client as well.
Yeah, so that's the first thing.
Mm-hmm.
The second thing is, and this is something therapists are fairly adept at, is looking at what the psychological, social inputs are. And here's how I would put it. It's a little more stark than the way we usually think of it. I would say that we're all brainwashed. Every single person on this planet is brainwashed. So you have to pick your washing machine. Do you want to have spiritual orientation to life? What kind of orientation do you want to have? Whatever it is that you want to have, you have to give yourself inputs that actually cause your mind to operate along that pathway. So it's very important. If you want to have a spiritual life, you don't really want to be watching horror films and the 6 o'clock news, because all those things do is give you fear. If you want to have a positive attitude towards life, if you want to have gratitude, you have to have inputs that actually support your starting to think in ways and noticing gratitude. So that means maybe you want to read prayers, or maybe you want to read about gratitude, or maybe you go into a 12-step program, or whatever it is. You look for inputs that will support that. You would not want to hang around people who are negative. You would want to have friends who are positive. If you want to be the best race car driver around, then you want to have inputs that help you in that realm. As a psychiatrist, I had inputs. I had teachers and readings and colleagues and patients. All of these things have shaped my brain and how my mind functions. We all operate that way, so it's very important to consciously screen and choose the sensory and psychological and social inputs so that what will come out will be what you want to come out, what your experience and lens will be and select for.
So I noticed why you use the "we're all brainwashed," at the beginning of this topic because it's a very powerful, striking image. But really, what we're talking about is that the myth of being a person in a way in isolation is a myth, and we are the result of our various influences and how we digest them. And so, we can exercise a degree of choice in terms of the milieu we're in, because that's going to affect us.
Right. That's absolutely right. And it's important to recognize that we are not static. We can become, let me change that. We can begin to experience the world through the lens that we choose to use. You want to see things in a positive way, you can begin to develop that lens.
And so, implicitly, what you're describing is that even if we don't have an exact prescription for the kind of input that's going to be giving us the best result, by being conscious of the relationship between input and output, we can also perfect this by trial and error.
That's right. It's a choice. There's no one prescription for everyone. Even if you said, I want to become a spiritual person, well, the inputs that you would find helpful and beneficial and meaningful are going to be different than the inputs that I would choose. Mm-hmm. So everybody has to make their choices about those things.
Yeah. So
I think it's important to recognize that these inputs that we're talking about then have a very significant effect on our physiology.
Mm-hmm. 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 So we've talked about two kinds of inputs, the diet and gastrointestinal tract, and psychological and social inputs.
Mm-hmm. So a third input would be air. And it sounds kind of silly, but the air we breathe is very important. And so you want to ask, and this is very simple for a therapist to do, ask a person what the quality of the air is. Are they working in an old building? Is it a musty place? Is it a 100-year-old building? Has there been flooding in the home? Has there ever been a flood in the basement? Is it moldy? Are you working in an environment, say, like a printer would, where there are toxic chemicals in the air?
Mm-hmm.
These things obviously can have an effect, depending on a person's sensitivity, can have an effect on their health and their mental health.
Yeah. Yeah, as you say, it's something that's pretty obvious, but we don't necessarily make the link between that and how we are and how we feel.
Right. And then maybe a fourth input would be bacteria. Let's say bacteria and viruses. So, for example, how careful are you in terms of sanitary habits? Are you exposed to infectious agents, whether it's in the classroom, teaching young children, or having young children at home? Are you living in a country area where there are ticks or other insect-borne diseases? Do you have fungal infections? This whole area of infectious illness, which is really, in a sense, another input into the system, can have huge effects on OCD, anxiety, panic, memory problems, mood problems, and even schizophrenia.
Yeah. So, paying attention to these four categories of input, and again relating it and noticing the impact on life.
Mm-hmm. Yeah, I think if somebody were to read over the transcript of this discussion or listen to this discussion again, you can make a list probably of 15 or 20 questions that you could even put into a questionnaire and just have your clients.
That's exactly. I was actually thinking about that and waiting to ask you if it's actually something that would be okay with you. But that's what this conversation is inspiring me to do.
Yes, absolutely. I think it's a great idea. And if people are interested, I do have a psychometabolic questionnaire that I've developed. I haven't looked at it in a couple of years because I do this myself in a pretty regular way all the time, so I don't really use the questionnaire for that. But it's something that I could forward to people, and they can see if it's complete enough for them. Mm-hmm. Or even better, really, I think that questionnaire, it's available, and I'm willing to send it to people, but I would also say you can just listen to this and just write out the questions. It's very straightforward. And if you do this with people, you will find that you can really influence their health on a fundamental level.
Mm-hmm, mm-hmm. Yeah. No, I mean, what I find really incredibly inspiring as I'm listening to this is, obviously, as I mentioned before, the practicality of paying attention to this and making the specific changes. But that it's also such a powerful way to communicate the philosophy of seeing things in a system perspective, the influence of environmental factor and body factor on the experience of life. That you could talk to people until you're blue in the face and not get through, but sharing that experience is actually a very, very powerful way to communicate the concept. So to me, that's at least as exciting as the specific contents, which is great.
Yeah, I'm glad you appreciate it because I think it's very powerful. Let me say this: if people just need to think of this in very simplistic terms, it's get the bad stuff out and put the good stuff in.
Yeah. And in an interesting way, that we're talking about bad stuff or good stuff, not just in terms of surface, but in terms of the basic structures of life, the underlying structures that make that give the good stuff.
Right, that's right. Now it's very interesting. If you don't mind my going on a little bit.
No.
So I was having lunch probably 15 years ago with my children and nephew, and somehow the conversation went to, well, if you could have one thing in life, what would you like? And the answers were villa and wherever, or Bentley, or this or that. Material. The answers were pretty much material. And what I said was, what I would like best is a good attitude. Because with a good attitude, you can handle anything. And even further than that, if you have a good attitude, your immune system functions better, your relationships are better, your gastrointestinal tract functions better, your adrenal glands function better, and certainly your experience of life is much, much sweeter.
Mm-hmm, mm-hmm.
So for me, that's if I could have one thing, that's what I would have.
Yeah. So the, in a way, the interface of how we function with all the components of the system. And that's part of where we can, to some extent, of course, it's not something that we can will ourselves to have, but there is an intentionality about realizing the value of that good attitude and doing everything we can to get there.
Yeah, I would say there's an intentionality and even added to that is a practice. And I would say that as therapists, you have to be very careful not to be always looking for the source of a problem. I think that's so easy to fall into, well, maybe it's because of this, or maybe it's because of that, or was it because of your mother, or was it because of your father, or your grandmother, or maybe you think this because of that. that ends up being a fault-finding, a problem-finding focus. And it's not that it doesn't have a place, but it could become a way of thinking about yourself and the world.
Yeah.
And that can be very destructive.
But also, interestingly enough, when you put it this way, it's not the same thing as looking at the underlying cause, because it seems like a cause because historically it might have contributed to it or even created it. But actually in the present moment, what perpetuates it is the practice, is what you're doing. So
Right.
just focusing on what happened historically is actually not going to address how it keeps being perpetuated in the present moment.
Mm-hmm. And the truth of the matter is, really, the real truth is that we can't really find cause. Most of the time, we can't really assign cause to anything because there's always multiple factors playing into something. Let's take a simple example. You were walking and you fell and broke your leg. You could say, well, that's why I'm in pain. Well, that's part of it, but why did you fall? Maybe you fell because you haven't been going to the gym, and so your core muscles are unstable. And maybe you fell because you have some neuropathy in your legs because you're taking Prilosec for your reflux, and Prilosec stops the absorption of B12, so your nerves in your legs are not really sensitive as they should be. Maybe it's because your mind was somewhere else and you weren't looking because you had an argument with your sister, or there actually isn't cause for most things. It's usually a systemic thing. So if we really look at things objectively, we'd see that there are always multiple inputs. But in this society, certainly in medicine, we're always looking for cause, and we think falsely that if we find one cause, we'll be able to solve the problem. But even with pneumonia, if I took 100 people and put them in a room and sprayed them with pneumococcal pneumonia bacteria, everybody wouldn't get pneumonia.
Right.
Certain people would because they're more vulnerable, but others wouldn't.
Yeah, and if you're obviously in terms of mental phenomena, things that create PTSD in some people don't in others, and some people are strengthened by some events. So again,
Right.
the idea that you cannot, the model or pain is not something that is linear in terms of, stimulus and response. So
Right.
there's an illusion about looking for a cause that is actually, instead of being proactive, is actually hiding how to deal with effectively changing things.
And it also creates a mindset of victimhood. Because we become the victims of someone or something instead of understanding that, in a broad sense, this is just where we are. There are multiple reasons for where we are, and it's worth understanding the multiplicity of this and then planning how to move forward.
Yeah. And so I want to reinforce what you're saying is that the opposite of that state of feeling victimized or of experiencing oneself as a victim is not the idea of grin and bear it, but is actually of realizing that there is some things, some possibility of making changes, some possibility of affecting the situation, and that by going in that direction and shifting and putting energy there, there is a possibility of agency as opposed to passive helplessness.
That's right. That's exactly right.
Yeah. So I'm going to just take a moment to check, if there's, that feels like whole, obviously not as everything you have to say, but as an introduction to the topic, or if there's something you might want to add.
I guess one thing I would add is that I call this whole psychiatry because it's a combination of traditional psychiatry and functional medicine, and other modalities, but also because it's important to remember that we don't know, and we will always not know a great deal, and it's really critical to have comfort with the uncertainty of not knowing. If a person needs certainty, a sense that they know everything or most things, then they, by definition, have to exclude anything that causes a disturbance in their comfort level. And so you end up excluding information and ways of thinking that could be very helpful in life. So not knowing and uncertainty is something that people need to get comfortable with and become aware of, that's part of why I use the word whole.
Yeah. Which feels, again, very beautifully related to what you said about, looking for a simple cause as a way to alleviate the anxiety of not knowing. And, that the idea of embracing the not knowing is related to that.
Yeah, I would like to maybe close with one more case, just to give a broader perspective. I have a patient who I treated who was 18 years old when I first saw him, and he had severe OCD. He came to me because he didn't want to take any medication. He had been in therapy in the past, was not helpful, and when he came to me, he had trouble bending one of his fingers. He couldn't straighten it out, actually. He kept it bent all the time because of a superstition that if he straightened it out, it would cause bad things. So actually he had a contracture where he really physically was unable to straighten it because the tendon had tightened and shrunk. So when I worked him up, I found that he had 4 different infections in his body, and by treating those, as well as a couple of hormonal and nutritional issues, and getting him into an exposure response prevention type of therapy, within 3 months he was back to normal, and without medication. And that's an example of how this approach can be helpful.
Yeah. So that's a very powerful example. And as you're talking, I wanted to share with you that my sense of whole psychiatry, in a way I understand it also as psychiatry that is anchored in the wholeness of what is a human being and the human condition.
I think that's very accurate.
Yeah. So, thank you, Dr. Hedaya.
Oh, my pleasure. Thank you, Serge.
This recording is part of the Somatic Mindfulness and Relational Psychotherapy podcast. See the website relationalimplicit.com.
Example of how this approach can be helpful.
Yeah. So that's a very powerful example. And as you're talking, I wanted to share with you that my sense of whole psychiatry, in a way I understand it also as psychiatry that is anchored in the wholeness of what is a human being and the human condition.
I think that's very accurate.
Yeah. So, thank you, Dr. Hedaya.
Oh, my pleasure. Thank you, Serge.
This recording is part of the Somatic Mindfulness and Relational Psychotherapy podcast. See the website relationalimplicit.com.